Hello and welcome. I am Dr. Lara, a clinical pharmacist specializing in functional medicine, as well as a certified yoga teacher and Reiki master. I run a truly integrative health coaching practice encompassing functional medicine lab testing, yoga and meditation, and a sprinkling of Reiki energy medicine. Join me here on Light Body Radio to break through your health plateau and come into alignment with your natural vitality. Hello and welcome, beautiful souls, and welcome back to Light Body Radio. I'm your host, Dr. Lara, and today we're diving deep into a topic that affects so many of us: thyroid health. Your thyroid is like the conductor of your body's orchestra, influencing everything from your energy levels to your sleep, your metabolism, and even your mood. But here's the thing. Conventional medicine, unfortunately, often misses the mark when it comes to truly optimizing thyroid function. And that's where functional medicine comes in. And today I'm going to walk you through how we can support this powerhouse gland holistically. We'll cover the signs and symptoms of thyroid imbalance, subclinical issues that often get missed by allopathic medicine, functional medicine testing, of course, supplements, and even how your thyroid impacts your sleep. So grab a cup of tea, get cozy, and let's get started. So I want to start with the basics, of course. The thyroid is a small butterfly-shaped gland in your neck, and it produces hormones, primarily T4 and T3, and these regulate your metabolism. And when it's out of whack, you can feel it everywhere. There are two main types of thyroid dysfunction: hypothyroidism, which is where the thyroid is underactive, and hyperthyroidism, where it's overactive. And both can throw your system into complete chaos and make you feel like crap. But the symptoms look very, very different. So I want to break that down for you first. If you're dealing with hypothyroidism, you might feel sluggish, like you're moving through molasses. Common signs besides fatigue, is fatigue that doesn't go away even after sleep, weight gain despite not changing your diet or eating healthy and still exercising, dry skin, hair loss, brain fog, feeling cold all the time, like you can't warm up no matter how many blankets you pile on. But on the flip side, hyperthyroidism is like having your engine stuck in overdrive. You might experience rapid heartbeat, anxiety, weight loss, even when you're eating more, sweating, like profusely sweating buckets, feeling jittery, and also trouble sleeping. But here's where it gets tricky. Sometimes these symptoms don't scream necessarily thyroid problem right away. And you might go to your doctor, with any number of these symptoms. And if your TSH number is normal according to them, then you're going to be told you're fine. There's nothing to worry about. Go home. So maybe you just are feeling tired and you're chalking it up to stress. Or maybe you are starting to lose some hair, but you think it's just normal aging, or maybe like postpartum hormone imbalances. But this is where it's really important to pay attention and to listen to your body, because there is this sneaky thing called subclinical thyroid disease, and a lot of people out there suffer unnecessarily. Again, because it's when your thyroid isn't functioning optimally, but your blood work might still look normal by those conventional standards that we talked about in a previous episode. So if you haven't listened to that episode, I encourage you to go back, because I dive deep into the quote unquote reference ranges versus optimal ranges, and why those two things can be so different and can really influence the approach to your health, both by yourself and your physician or your practitioner, whoever you're seeing. So maybe your TSH, and that stands for thyroid stimulating hormone, is creeping up, but it's not high enough for an allopathic doctor to necessarily slap a diagnosis on it yet. You might feel off. You might be feeling tired, moody, puffy even. but you keep getting told everything's fine. You're fine. There's nothing to worry about. Go home. Sound familiar? I know I've definitely been there. I've been extremely frustrated in physicians' offices. And there was even one time where I brought them a more comprehensive thyroid panel that wasn't just a TSH and it showed some imbalance. And the physician looked at me and just said, I don't know what you want me to do about that. So, needless to say, I never went back to that person. But I don't want you to find yourself in that situation. And if you have, then I understand exactly where you're coming from with that frustration. So we need to dig a little deeper because subclinical issues can still wreak havoc on your quality of life. And, we already have so much coming at us every day, especially in the Western world. The last thing we need is to be being told that we're crazy by our physician or that we're just making things up in our head. When we know we don't feel good, we know something is amiss, and we're just looking for answers. So let's see if we can address some of that. So, of course, if it's subclinical, again, you're not feeling great, but your numbers aren't necessarily like glaringly horrible, then it still needs to be addressed. So, this is where within the functional medicine world, and hopefully, if you find, a proactive allopathic physician out there, the proactive approach can really be a lifesaver and it can address it before it becomes a bigger problem. So, how do we do that? First, always in functional medicine, we look at the why. Is it nutrient deficiencies, chronic stress, systemic inflammation, toxic exposure? Maybe it's autoimmune issues like Hashimoto's or Graves' disease, because there's specific testing for that too. So we figure out where the source is, and then we use targeted testing and personalized strategies to bring your thyroid back into balance. So let's talk about testing now, because of course, like a lot of my episodes, especially as of late, I've been focusing on what's the difference between the functional medicine perspective of testing and the allopathic or the Western medicine, the more traditional approach to lab testing. So I think, especially with the thyroid, this is where functional medicine lab testing can really shine and give us some great information. In conventional medicine, the first thing that they always start with is a TSH. And a lot of times it's only a TSH. And if it's within a certain range, let's say anywhere from like 4 to 10, then you're told that you're normal. Some physicians will, raise their eyebrows if you're above a 2. But if you just have one level that's barely above a 2, then, most likely you're going to be told that you're still normal. Even if you do come to them with complaints of symptoms also. Maybe if you're lucky, they'll order a T4. And sure, those labs actually they do give us a snapshot, but they don't tell the whole story. And like many things in our body, the thyroid is a series of chemical steps, chemical reactions, feedback loops that one is based on the previous thing coming out of it and so on and so forth. And so if you have one little piece of that cascade or that cycle that's out of whack or out of balance, then it literally can throw the whole thing off. So I think it's important, and most functional medicine providers also think it's important to look at the entire cascade, look at all the chemical reactions that are going on within this area of the body. So we're going to look at a full thyroid panel. So what is that? That's a TSH, that's a free T3, a free T4, a reverse T3, thyroid antibodies like TPO and thyroglobulin antibodies to check again for that autoimmunity piece. And why? Again, because TSH alone just doesn't tell us how your body is converting T4 to T3. And those are the two active hormones that are driving your metabolism and driving your thyroid function. So if your immune system is attacking your thyroid, then that'll all show up on these tests. So let's talk about reverse T3. If your body's under stress, it might pump out reverse T3 instead of active T3. And this could leave you feeling exhausted even if your TSH looks fine. Conventional testing misses this quite often. And so functional medicine labs we also consider nutrient levels. So with every single one of my clients, the one thing that I never skip is a micronutrient levels, because I want to know what your iodine level is, what's your selenium level, what's your zinc level, because if any of the three of these are low, then you're not going to have the full optimization of your thyroid hormone production and function. We might even look at cortisol, of course, gut health, and because these can throw off your thyroid too. So it's all about connecting the dots, not just checking the boxes. And again, with functional medicine, we're looking at the whole body, we're looking at systems and how they are connected together. And I'll bring in another aspect of that later on in this episode with sleep, just to show you how things are fully connected. But I think this is a great opportunity. The thyroid is a perfect example of how your imbalance can start in one area of your body, but it really does have a cascading trickle down effect to not only other functions and aspects of your health, but then again, how you feel, how do you function, what's your quality of life. So we've done the testing, we have data. So now what do we do? So from, again, functional medicine perspective, we look at supplements. And so you don't have to go straight to pharmacy for pharmaceutical medications. And supplements can be a game changer. For example, hypothyroidism. Again, we often recommend looking at selenium, so we want to test that level and see where you are. Selenium helps with the T4 to T3 conversion, and it protects the thyroid from oxidative stress. So we definitely want to make sure you have enough selenium, especially if within that testing, it looks like you might have a T4 to T3 conversion problem. And this is actually something I see quite often. The TSH is quote unquote normal, but when you look deeper, there's a conversion problem, and that's what's causing the symptoms, which luckily enough, that's actually an easy fix. Then we just look at nutrient deficiencies. And, then again, like we can fix that with not only a supplement, but we can also fix that with diet. So you don't necessarily have to take a supplement. Usually, what I recommend is just taking a supplement for 1 or 2 months to get your levels back up faster, to get you feeling better faster, and then really focusing on dietary choices and making sure you're getting a consistent amount of selenium in your diet. So beyond that, we also have zinc and magnesium, which are two big players also. And these are also help support hormone production and your energy levels and production. For hyperthyroidism, we might need to lean into more calming nutrients and adaptogens like L-theanine or adaptogens like ashwagandha to ease the overactive state. But again, this is always tailored to the individual. We don't skip the basics. A nutrient dense diet with healthy fats, clean protein, and tons of veggies definitely is what your thyroid needs. Lots of leafy greens. Again, sources of iodine. So that's where I want to go to next with this. A lot of times we don't even hear about iodine from Western medicine. So let's talk about that for a minute, because iodine really is the superstar for thyroid health, but it's also very misunderstood. So iodine is the building block of thyroid hormones. Your thyroid takes iodine from your diet, so seaweed, fish, or iodized salt, and it uses it to make T4 and T3. So without enough iodine, your thyroid literally can't do its job. And you might even end up with hypothyroidism or even a goiter, which is an enlarged thyroid gland if you don't have enough iodine. Iodine is considered a micronutrient, so you don't need a ton of it, but you do need some. And especially in the Western world, there has been a shift towards withholding iodine from things like our salt and in different aspects of our diet. So we really need to pay attention. So too much iodine can harm your thyroid, especially if you have an autoimmune condition like Hashimoto's. So it's very important to check for those autoimmune conditions specifically. And excess iodine can trigger inflammation or even worsen hyperthyroidism in some cases as well. So iodine should never be done on your own. It should always be done with an educated, well-trained practitioner, but it is possible. And so it's sort of that Goldilocks style, like you want just the right amount. And then so in functional medicine, again, we don't guess, we test. So we're going to test your iodine levels first. And often this is done through a urine test to see where you're at. If you're deficient, we're going to start with a low dose because also within the pharmacy realm, one of our mantras that we're taught in pharmacy school is start low and go slow. I don't know why they're not taught this in medical school. And if anyone out there is listening and you did hear this in medical school, great. But I work with physicians every day, and oftentimes they think, well, if some's good, then more's better. So, and that's often not the case. Like even in allopathic medicine with pharmaceuticals, start low, go slow. A lot of times you can get that nice efficacious dose on the lower end. But I'll get off that soapbox for now. So, where was I? Um, yada yada yada. Coming back. Oh yeah. So we're gonna start with 150 to 300 micrograms a day. So that's a very small dose. And this is what you can get from food. So again, we always want to start with the things that are on the natural side. So kelp, seaweed, um, iodized salt, fish, and we monitor it closely because, again, more isn't always better. So we want to pair the iodine with selenium to make sure that they are working in concert together appropriately. And the selenium helps your thyroid use the iodine safely and efficiently. So, again, that's why a lot of times in the biochemistry world, instead of nutrients or vitamins, we call them cofactors. And the reason they're called cofactors is because they work in concert together in those chemical reactions in the body. And so you really need both of them to get the ideal outcome that you want. And so, again, this takeaway is that iodine is essential, but it's all about balance and personalization. And usually, you do also want to take it with selenium and some zinc as well to really maximize that thyroid function. So, let's move into the next phase of this little conversation, which I know we all crave and feel like we don't get enough of, which is good sleep. And your thyroid and sleep really are the best of friends when things are working right. But when things are not, and even again in that subclinical area, you might feel like sleep is your enemy or like so elusive. So, hypothyroidism can leave you feeling exhausted already, just in and of itself, but then you're unable to sleep deeply. And so then you get into this vicious cycle of you're too sluggish and you don't cycle through those restorative stages of sleep. So you wake up feeling exhausted, you feel tired and exhausted throughout the day. Oftentimes, this leads to not feeling well enough to exercise. So you stop exercising, you start gaining weight. And then again, like this just starts a vicious cycle. So it's really important that we try as hard as we can and not ignore it, the sleep aspect of our thyroid balance. And if you're suffering with hyperthyroidism, then good luck shutting off that racing heart and racing mind. So, poor sleep then stresses your system even more, again, creating this vicious cycle that continues to just tank your thyroid even further. So, in functional medicine, we love to optimize all of the things, right? And so, we're going to optimize your thyroid health to break that cycle. And then we're also going to optimize your sleep hygiene and ideally your sleep hormones. When your hormones are balanced, your circadian rhythm can get back on track. And so you're not just sleeping more, but you'll be sleeping better. So think about waking up refreshed instead of dragging yourself out of bed. Wouldn't that be nice? So that's really the goal, is everything optimized and everything balanced and everything working in concert together beautifully. So here are the takeaways from today. If you're feeling off, if you're feeling tired, maybe even wired, foggy, or not yourself, don't just settle for a quote unquote normal lab. Even if that number looks normal, according to that reference range that's on that piece of paper, we know that that's not the optimal range. So even if you don't have a functional medicine practitioner, you can actually Google what is the optimal range for whatever lab you're concerned with. So whether it's your TSH, your T3, your T4, and advocate for yourself. Ask your physician to dig a little further. Re emphasize those symptoms with your practitioner. Get curious. And again, if you're just not making headway with your current practitioner, find a functional medicine practitioner that will help you get to the root cause, test comprehensively, and build a plan that's personal to you, that's all about you. You deserve it. Your thyroid deserves it. And everyone in your life will also be thanking you because you'll be able to show up as that beautiful, shining self that you are instead of the slow, sluggish, irritable person that I know a lot of us can be when we're not feeling good and we're not feeling our best and we're not sleeping well. So I hope this episode today maybe clicked a little, maybe turned on some light bulbs, and is maybe encouraging you to ask some more comprehensive questions about your metabolic balance and your thyroid health. If you'd like to dive deeper into this with me, then definitely reach out. If you feel like you're one of those people that has been told their labs are normal, but you're still not feeling well, please reach out to me. I'm happy to help. I have a variety of tools and programs that we can get you started with no matter where you are on your journey. And so, again, I love you all. I'm so glad you tuned in today. And if you know also of someone that this might resonate with, please share it with them because we want to help as many people as possible. So, until next time, we will catch you later. Namaste.